Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
You know, Tracy, for decades, doctors have been telling men over 50 and women over 60 that they should be taking a baby or a low-dose aspirin to prevent heart attacks and stroke. But just a couple of weeks ago, the American College of Cardiology and the American Heart Association scrapped that recommendation. They changed their minds, at least in part.
To keep you on your toes, that's why. And there's more recent news on heart health. A new study says that maybe eggs aren't as good for you as we first thought. The more that you eat, the greater your risk for coronary artery disease, stroke, heart failure, and premature death. But I really love eggs, so that's trouble. It's time for a conversation with our Mayo Clinic heart specialist. With us in studio is cardiologist Dr. Stephen Kopecky. Welcome back, Dr. Kopecky.
Thank you.
Dr. Kopecky, good to have you here. It seems like doctors change their mind a lot. Where are we now with regard to a recommendation for low-dose aspirin for prevention of heart disease?
Well, Tom, it's difficult. You know, aspirin is a new drug. It only came out about 1830. And so
we haven't had time to test it.
That's right. But what has happened is something I never thought I'd see, and that is now the American Heart, American College recommendations are a red box, a class 3, do not do. Do not give aspirin to those over 70 routinely. Do not give aspirin to those with bleeding problems routinely. So you have to ask them about it. And so what has happened is that you need to assess someone's risk for heart attack and stroke. If it's high, also ask them about their risk for bleeding. They've had bleeding problems. And if you're a high risk for a heart attack or stroke, no risk of bleeding problems, then you may be benefited. However, to give everybody across the board in these groups an aspirin, we have to treat about 250 people to prevent one heart attack or stroke. But we treat 200 people to cause a major bleed. So it's not beneficial unless you really risk.
So wait a minute, you treat 1 out of 200 people for a major bleed?
Yeah. You would treat 250 people with aspirin, and out of those 250, 1 less would have a stroke or heart attack.
Okay.
But if you treat 200, 1 of those are going to have a major bleed. So you would get to a major bleed before you prevented a heart attack or stroke.
Okay, so what you're saying that for certain individuals, the risks outweigh the benefits of a low-dose aspirin every day.
Right.
What about people who have had a history of heart disease?
There is no question those people benefit from aspirin if they can take it. Again, if they've had bleeding problems, they may not be able to take it, but we have other options to do also.
What's a bleeding problem?
Well, a bleeding problem is if you ever had an issue with gut bleeds, you've had blood in your stool, whatever. If you've had problems where you threw up blood, if you've had problems where you've had a bleed in your eye or something like that, obviously. This can happen with people that take a lot of like over-the-counter pain remedies. That could be the type of problem you could have, and that's something we have to ask about.
I saw an ad over the weekend when I was traveling, and it was in the back of a major newspaper, and it was a Bayer ad. And it said, aspirin continues to be the cornerstone treatment for the prevention of secondary cardiovascular events. What exactly does secondary mean, and do you agree with that?
Yeah. Well, secondary means that you have had some heart disease or some arteries that were narrowed. You may have had a stroke, you may have had a bypass, a stent, something like that. They had to bypass your leg artery because it was narrowed. So that's secondary. There's no longer risk for disease because you have the disease. In those patients, the ad is correct. They would be benefited by having something that will inhibit the platelets, which are cells in your blood, about 1/10 the size of a red blood cell, that their job is to clot. And if you can benefit by taking that if you don't have risks of bleeding.
All right, so when you say a history of previous heart disease, is this just heart attack is what we're talking about, or what else might qualify or you classify as heart disease?
Yes, and that's finally been codified or put down on a list so we can all know exactly what it is. And the FDA and the American College and American Heart have all agreed. And it falls into 3 areas. One is the heart. If you've had a heart attack, if you've had a stent, if you've had a bypass, if you've had a CT scan that showed you had a narrowing of an artery or an angiogram. Now
so that would be calcification in the artery?
I was going to say that's not calcification.
Okay.
That doesn't count. Or it could be that you've had a stroke, the arteries to the head, you've had a stroke, you've had an ultrasound that showed an plaque or buildup of narrowing of the arteries to the head. That would count. The third group are the ones that have had the arteries that aren't the head or aren't to the heart. That's the rest of the body. It could be the aorta, which is the large blood vessel about an inch or so in diameter that runs from our heart down to our legs. People that smoke tend to get enlargements of those, and so you've had an aneurysm, it's called, or a bypass of one of the leg arteries, or narrowing. Sometimes you go in, your doctor may hear a bruit, which is a sound like a finger at the end of a hose. Psh, psh, psh. That could be a narrowing of the artery, too, that would count.
All right, before we go on to eggs, what about someone who has been taking aspirin? They haven't really had a problem with it, but they have no history of heart disease, and they decide they want to stop taking it. Isn't there some increased risk of a heart attack or some other complication if you just all of a sudden stop taking it?
Yeah, there does seem to be clearly a risk. And the higher your risk, the higher the risk of having a problem. Meaning if you've had a stent placed or had a bypass or a heart attack in the past, you're clearly at risk if you stop it. I would talk to your primary care provider about that before you do.
So before you stop, talk to your doctor.
Yeah.
All right, let's talk about eggs. Because I think this story just kind of waxes and wanes over the years as they go by. Like, are eggs good, are eggs bad? And it's probably truth is somewhere far in between.
Yes. Eggs, nature's perfect food. A lot of protein in the white, a lot of fat in the yolk. Why are they steadily saying they're not good? Well, the studies on eggs, any study on any food product or anything that's over the counter for that matter, it's very hard to randomize, meaning say you take an egg and you don't take an egg, because you can buy them in the store and eat them, and many of the things we eat have eggs in them. So what have we found? Well, the average American eats about 3 or 4 eggs. When I say egg now, that's the whole egg with the yolk and the white a week. And their risk of a heart attack is here. So it's 1. But if you eat a couple eggs a day, your risk goes up about 25%. Now, we know the Mediterranean diet studies, which we are big advocates of here. In that study, they actually suggested only 3 or 4 egg yolks a week. So I have an egg every day, but I cut out half of the yolk. And so I put something else in there, spices or whatever. So I'm getting about 3 or 4 egg yolks a week, which is about the average American's intake. And that's probably okay as long as I'm not eating a lot of other saturated fat or cholesterol. Now, the problem is that every egg yolk has about almost all of your daily allotment of cholesterol, 200, 250 milligrams of cholesterol per yolk. And the old studies didn't show much damage to eating eggs. Why? Because Americans eat so much other cholesterol that the egg yolk, adding it to it, really wasn't that bad of a thing. Where do we get it? Well, we get the other saturated fat or cholesterol in meat, dairy products, hamburgers, things like that. So you've got to be careful. If you want to have the egg, cut down the other saturated fat or cholesterol you're eating throughout the day.
Or take part of the yolk out. So this new analysis from Northwestern University that is the basis for our conversation, it said that each additional 300 milligrams per day of cholesterol, and you said there's 250 milligrams in an egg, 250? Each 300 milligrams per day additional increases the risk of cardiovascular disease, that's heart attack and stroke, by 17%, and increases the risk of premature death from any cause by 18%.
Yes.
You agree?
I agree with that. And, death is inevitable, but premature death is not. And so I think what we're hearing, the message we get over and over again about the aspirin, about the eggs, whatever, is live your life in a good manner. Have healthy habits. You can't expect to take an aspirin and have it negate all the other bad habits you do. And you can't say, well, I'm just not going to eat this egg yolk, but I'll eat everything else that's bad for me. It's not that either. You've got to really put it all together in a package.
All right. Well, the good advice. So the bottom line is you probably would be a good idea to limit your egg intake unless you cut out half the yolk or you limit the amount of cholesterol you get in the other part of the day. And also talk to your doctor before you start or stop a low-dose aspirin regimen.
Good advice.
All right. Mayo Clinic cardiologist, Dr. Stephen Kopecky, thanks so much for being with us.
Thank you.